Hi, hi. My name is Bumsoo Park. First of all, I really want to thank you all for this, great session, great discussion. Really honored to be. I'm a family physician. I'm a primary care physician, PCP, and currently leading clinical medical director. And I've been here in Michigan Medicine for 6 years, but total as a family doctor for 10 years. And then I also have about 10-year experience career as a full-time neurologist in South Korea. Just wanted to share my background first. So when I first got this, reviewing the agenda, so healthy measures lifestyle for prostate cancer. So I was thinking about, this is interesting because when we talk about prostate cancer, usually we talk more about cancer screening, treatment, diagnosis, monitoring. Have I really thought about healthy lifestyle measures for prostate cancer? When every day I see my patients as their PCP, do annual exam, I talk a lot about healthy measures. And the other side, I also see, patients for prostate cancer screening, but have I combined these two? So that was my first question. So that was very interesting. This is a slide that I have. So I have a clinic called PCRC at Michigan Medicine. So I see patients once a year to talk about cancer screening and then counseling and prevention and things. So I see patients with higher risk, such as significant family history or cancer genetic mutation. So let me start. So what is the lifestyle for prostate cancer? What is the healthy measures for prostate cancer? So how can we approach this? So I was thinking about maybe before diagnosis and after diagnosis. Before diagnosis will be cancer prevention, and after diagnosis will be cancer survivorship. And what is the best approach to this when we talk about healthy measures? As a PCP, I get a lot of questions from my patients. Doc, can I take some vitamins? Can I do this? What food should I eat to prevent prostate cancer? What vitamins should I take? And unfortunately, there's not really a specific, interesting thing that we can pinpoint to say, oh, this one will prevent prostate cancer. That one will do. Because I was thinking about, it's actually kind of hard to exactly study it, because even though we designed a designed randomized trial, there's going to be a lot of confounders to accurately measure this certain product, if this certain product can prevent a certain cancer. So when I talk to my patients, I always say, let's think about healthy lifestyle. So instead of thinking about something new, instead of thinking about eating or taking something new, why don't we think about eliminating something bad? Because I always say that might be way more important approach to maintain health instead of starting something new. Because many people, including myself, have some sort of unhealthy habits if we really sit down and think. So then I always talk to my patients that might be the first approach. For example, like someone smoking, Doc, I really want to be healthy. Why should I take some vitamins? I always say, let's talk about the smoking cessation first. So my approach is, let's remove modifiable risk factors. So if there's certain confirmed risk factors which can be modified, then that would be the best approach to prevent prostate cancer. So this is pretty much the slide. This is conclusion pretty much of today. Those three are the confirmed modifiable risk factors for prostate cancer: weak consumption, trans fat, pro-inflammatory diets. We'll go over this a little bit. There's a slide table right here. I actually intentionally made this very small because I didn't want to go over all of these. So right side is confirmed, the left side is possible, and the upper half is modifiable risk factors, and the bottom half is modifiable protective factors. As you can see, actually there's no no confirmed modifiable protective factor. So there's not no specific food or vitamin events. But upper half, right side, there are 3 confirmed modifiable risk factors: meat consumption, trans fat, and pro-inflammatory diet. On the left-hand side, there are a lot of possible things right here. I don't want to go over that because it can potentially give them false belief. Oh, because there are many, interesting items here. Even vasectomy is there, even ejaculation frequency, aspirin. Because this can potentially give them false belief to change their lifestyle or even their medications. So, no. Meat consumption, so consistently evidence. Usually processed meats are the problems. As you know, bacon, ham, sausages, those things are known carcinogens actually. So they are one of the risk factors. So maybe first approach will be to kind of review the diet and do I really eat these, and then that might be the first approach. But of course, except for vegetarians, vegans, and many people will still consume meats. Per USDA, the recommendation is 26 ounces per week, and they recommend to consider other protein sources. So these are just examples. So we can kind of moderate the meat consumption. But this doesn't mean that we have to completely avoid meat consumption. Trans fats are different. Trans fats are vegetable source. It's different than saturated fats. Saturated fats are animal source, and trans fats are vegetable source. So saturated fats we cannot completely avoid because if you purchase things in the grocery, there's many food products have some sort of saturated fats, but trans fats are the ones that we should consider to avoid. So these are examples. Many delicious, food items here: French fries, pizza, and biscuits, rolls. But unfortunately, they contain a significant amount of potentially trans fats that we should consider to avoid. Pro-inflammatory diet is the third item. This is kind of like an umbrella term. This already contains the other 2 that I just mentioned, trans fats and red meats. So this is a group of diet that is known to induce inflammatory reaction in our body. So for example, oxidative stress, and there's a lot of biochemical reaction and inflammatory reaction. So these are examples. It already has red meats, processed meats, French fries, trans fats, which I mentioned, and also some other carbohydrates, margarines, things like that. And then the question is, Doc, should I completely avoid these? I mean, I happen to eat, consume these. So my answer will be, probably cannot completely avoid that. But then why don't we think about anti-inflammatory diet to kind of neutralize pro-inflammatory diet? So these are the examples: tomatoes and green leafy vegetables. We always talk about these healthy food. Then the question will be, can these foods prevent prostate cancer? There's no scientific evidence, but maybe indirectly, if we assume that these anti-inflammatory diet can reverse the process of pro-inflammatory diet, may be possible. So that's why we always recommend these healthy fish, vegetables, fruits, vegetables. Then the question is, what about exercise? Yes, I haven't mentioned exercise yet. So next slide, exercise. There's no clear increased risk of prostate cancer with sedentary lifestyle, but exercise may reduce prostate cancer mortality and improve cancer-free survival. So this might be relevant to prostate cancer survivors. A lot of benefits, biochemical mechanisms from exercise against cancer. So what should we do? So this is American Cancer Society recommendations. So about 150 to 300 minutes of moderate intensity activity each week. That can include brisk walking, cycling, swimming, or gardening. Maybe half of that, 75 to 150 minutes of vigorous intensity, can include running, aerobics, playing sports like basketball, soccer. So this is Cancer Society recommendation by exercise for cancer prevention and survivorship. Equity issue does exist, for healthy lifestyle. For example, access to affordable, nutritious, healthy food, same sidewalks, infrastructure for regular exercise, limited access to healthy information. It can lead to disparities and social determinants of health, which we touched on earlier in the day. So first, it will be difficult to immediately, fix this problem. Of course, we will require a lot of discussion and policy. And we can spend the whole afternoon for this topic. So this is my last slide. So I think one of the panels actually mentioned earlier today. So if we cannot change right now, then what can we do right now to remove the health, to try to remove health disparities and to promote equity? I think it eventually comes from the humanities. So the doctor-patient relationship still. So my assumption, my theory is, if I have a truly trustful relationship with my doctor, so I trust this patient trusts me, and then we can try to fix the barrier. We can review individually about what the barrier is, and we can work together to accommodate. So eventually we can reach the healthiest, the goal of healthy lifestyle for the patient.